What are the problems with the welfare state? James, please.
Well, I think I think one problem that we have now is, if you like, that we don't really have a welfare state. Certainly speaking from the UK perspective, although I think there are resonances here as well in very much of Europe. Historically, there have always been difficulties with the welfare state, balancing the fact that, on the one hand, it strikes me as clear that a decent society is one which should be able to provide for its citizens when they hit hard times in periods of unemployment, when they have problems with ill health. A decent society, in relation to the last discussion, is one which should be able to provide a decent and rigorous quality of public education for all citizens. That's something that the welfare state has provided sort of throughout its history. But it's also the case that we need to recognise that the welfare state has never really been driven by that demand for social justice or socialism. It's always been far more driven by the requirements, I think, of market society, from the British example all the way back to the turn of the 20th century and the first developments of welfareism. They were actually about a recognition that the British working class couldn't fight to defend British imperial interests, all the way through to the introduction of a more established welfare state during the Second World War. You were looking at a whole range of measures that were required in order to create citizens who could work and function in a capitalist economy. So historically there has always been a trade-off, I think, between allowing citizens to take control of their lives and actually the state controlling citizens. What's happened, I think, over the past 20 years, however, is that we've moved from a condition of welfare which assumes that generally people are able to take control of their lives, but that from time to time they may need a degree of assistance to compensate for the failures of market society. And we've moved instead to what I'd call a therapeutic enabling state, which begins from the assumption that people are vulnerable, that people are unable to run their lives, unable to take control of their lives, and therefore assumes a very diminished image of the citizen, and assumes that citizens actually need the state to step in to assist them and to help them and to mediate their problems in almost every area of their lives. And there are numerous examples, perhaps we can go on to discuss the examples, but in everything from education to healthcare to childcare to unemployment, the general assumption now is that people are incapable of acting in the world and controlling their lives, and that the only way in which they can possibly get on and become decent citizens is with state intervention. So in that sense, the modern welfare state, or the modern therapeutic state, is hugely disabling to people. That's the problem.
Okay, thank you. Erik?
Yeah, I couldn't agree more with Grendel. It's actually quite good analysis, I would say. One of the problems with the welfare state today is with the development that we have had in the history, which has made people free to create and become whatever they want on most levels in life. We still have a bureaucratic system that locks people up in the welfare state, just as Brennan says here. So the problem for the welfare state is to figure out how to deal with the individual's requests and wishes, and to hand out the tools for everyone to use, not just to put them in a certain system and decide which way to go with every case. I think the more and more individualistic society we get, and where we all can reach our dreams in a much higher level than ever before in history, the welfare state has to focus on those that doesn't have the tools, doesn't have the background, that really needs the help in the crisis, but not assume that everyone always needs the help from the welfare.
Matthias?
Yeah, well, don't get me started. I was about to say, the problem with the welfare state is that it is mainly a very illusionary idea, creating some quite harmful illusions that makes us content with quite crappy services. It's almost in any country you have the idea that you create some kind of national myth around your welfare system because they're national, they're not competing with other systems, and people have rather not much knowledge about other systems. So, for example, in Sweden, you have this idea that Swedish welfare is unique. Well, it's not, and it's not very competitive. And yet, people from all kinds of political parties claim they're so proud. They're very proud of the Swedish welfare and the Swedish welfare state. And I wonder, what are they so proud about? Because when you look at the actual services we get, for example, in the healthcare system, Sweden is not having the best healthcare system, and we definitely do not have the best pay for the employed in the welfare systems and in healthcare. We have queues instead of actual services. We have malpractice, and it's definitely the same with NHS, which still is untouchable from all political parties in Britain, because you don't have any alternative. And I think instead of pride, the motivation is fear, because people have been made to think, without all these benefits I get from welfare state, I would never be able to sustain myself. I have pensions and school and healthcare and daycare for the children, and I never see the money that pays for all of this, because all I get from the tax authorities as an ordinary citizen is a bit of pocket change money back from all they charge me via my employer. So I never saw what I paid for it, only the services. So that is one of the illusions that is created by having these state-administered monopolies on welfare. The other is, of course, the thing we were into before, that the welfare state is an invitation of busybodies to start the lifestyle regulation of other people. For all this talk about solidarity, we're very solidary. We want to pay for everyone's health care. But I will not pay if you haven't had your bicycle helmet on. I mean, really, that's the kind of thin solidarity, because the moment you face someone not living exactly as you, you're not willing to pay anymore. And it's quite funny, because it could be small costs, like, for example, bicycle accident, quite small, and have been decreasing without people using bicycle helmets anyway, because traffic is much safer. And you have other examples, like I don't want to pay for people being fat, or people smoking, or people having abortions. You say you don't want to pay for that. And the thing is, when you look at the actual costs, usually people are more costly for the healthcare in the long run by living a healthy, long life. Then we die from expensive diseases like dementia and so on, instead of cheap diseases like lung cancer.